My name is Peter Swift. I've been retired for 4 years, and I've just recently had a hip replacement operation in September at Blackpool Teaching Hospitals. One of the main objections I have about nurses or any staff in the hospital that not wearing ID cards, I spent a lot of time trying to remember names that other colleagues have called them, so I could be friendly as well. If somebody called her Julie, I'd try and remember that was Julie, but then shifts change and then you get different people coming in, etc. It becomes a dead loss. One of the things I noticed most was a sister's uniform has sister embroidered across the chest, and I never saw one sister with an ID card. Not one sister had her name on a badge anywhere, on a waistband, on a lanyard, on a pin, anywhere. I assumed that they just wanted to call sister and that was it. Younger nurses, nurses of different rank or rate, some would have an ID card tucked between the buttons. I can understand that if it gets in the way of treating somebody. Some had keys dangling from them that just completely obliterated the name or the photograph, and some didn't wear them at all. It first came to my notice in haematology actually. Much earlier this year, a nurse who was very abrupt. She didn't ask me to do anything nice, she never said please or thank you. I thought I'd like to get her name, and her name was tucked into the buttons of her tunic, and there's no way you were going to find out unless you asked the reception, but that was another story. I think the nursing profession is filled with empathy, naturally. And empathy would be involved if a nurse introduced herself if she had no ID card. Or you could see her ID card and you just call her by that name. But some people, you say, hello, I'm Julie. And that was fine. And it gave you a bond. I mean, Julie knows everything about me. She's got my records in front of her. She knows exactly what's happened to me and what's going on. But sometimes more than I do, because I don't know what the doctors are going to decide. They have a very good idea. So there is that bond, whether it's an introduction by word of mouth or whether it's an ID card, and you can take the bull by the horns and say, hi Julie.